Elisha speaking here. When we talk about orientation here, we're talking about the very first email that you got is going to look like this on the top. It says onboarding orientation. Dear graduate, welcome to NP Certification Academy and thank you for enrolling in Dr. Kehinde Elisha's review. We're excited to have you join our community of future nurse practitioners at NP Certification Academy. Your success is our top priority. Our comprehensive review aligns with latest exam standards with a strong emphasis on DSM-5TR to help you confidently prepare for ANCC and AAMP PMHNP certification exam. We understand the very first few weeks feel challenging, especially as you join a class with students who are already a few weeks ahead, guys. That alone is a challenge, but don't worry. That challenge is supposed to be something to kind of propel you even forward. Please be patient during the first 2 weeks. Take your exam, follow instructions closely, and trust the process. You will find your rhythm very soon. So to help you get this started, you gotta watch orientation video. This orientation video for some reason is not linked up here, so it's linked down here. It's 24 minutes. I will give you a little glimpse of it. View the current class schedule. This will take you straight to the website and show you the current class schedule. And then join our WhatsApp group for updates and peer support. Don't forget my evening and night class, afternoon and night class. Maintain that class for now. I'm also going to be opening a morning class, but it's only going to be for 2 months. So those people that sign up for morning class are the only ones that will be there. It's only like 2 or 3 students. So I just don't want students attending 3 different sessions in a day. I think it's too much, to be honest. That will keep you away from studying on your own and reflecting on what you need to know and learning things your way. But if you want, you just have to let me know and then we'll find a way around that. Now, class schedule updates Tuesday and Thursday. We used to be Wednesday and Thursday. We just switched. Actually, this is like almost 3 weeks now that we have been doing Tuesdays. So we are settling in it. So things will start changing. I will start changing the document on Canvas, start switching things up, but not out of your awareness or nothing too crazy. Now, we're now going to go on to the bottom of the same email. It shows you your Zoom. Now, this Zoom, you're not going to get it next week. You're getting it this week. This is not the way to protect the integrity of the course. I really hope you understand that. Very easy to forward and everything. But your Zoom link, we're going to plant it inside what? Inside Canvas. But your first week, we just don't want you coming in and getting lost. So we make sure we send you the Zoom link for that reason. For the first week only. Sometimes for the second week as well, but no more than second week. WhatsApp application is here. Request WhatsApp access. You're going to tell me the same email that you sign up with so that we can check and make sure that we're adding the right person in the group. And this is just telling us the sequence at which we teach the course. The details, like for example, the a little bit of policy, actually, attendance policy, learning approach, just kind of the way the class is set up. The one below it, this one right here is what I was kind of talking about, talks about the structure of the course, how we talk about neurobiology, psychopharm, psych assessment. We stick definitely with guidelines, nothing less than that. We cannot operate with anything less than that. And the class schedule is also right here. And in the middle, the one I skipped was talking about Canvas, how to set up Canvas, the step-by-step approach should you have any problem setting up your Canvas. This is the exact way to do it. I really hope that makes sense. If you're struggling, just give me a shout or email or call or text. Please, it is not too much to text me twice. It's totally okay. If you text me multiple times, that's fine. I promise you're not being a nuisance. If you asked me a question before and I didn't respond, please don't take it personally. I'm not kidding. I'm dealing with over 3,000 students, period. My experts that pass their board exam, they are also under my wings and they also reach out to me. I'm just letting you know the fact. So things do really get buried fast. I joke around sometimes when a student says, oh, I texted you 12 hours ago. I say, oh my gosh, are you kidding? It is down in the dump. That is just a joke that, hey, it's buried down already. I probably picked it up and I didn't respond when I picked it up. So you're going to go ahead and resend me another one. I am sorry, that can be annoying, but please bear with me through that process. I can't assign people to pick up my message because they wouldn't know what to respond to the person sending me a message. Does that make sense? Now, I have WhatsApp that someone else attend to that add you to the group whenever you come in. That's why I say when you are asking to get into the group, make sure you are requesting through WhatsApp. Make sure it's not a direct text. A direct text is just me handling it. So my direct text sometimes is very short. And I want to also encourage you, if you are texting me directly, it's okay if you don't salute. Just say, hey, I have a quick question, boom, and go straight to the point. I promise you that is just fine with me, okay? Just because I don't want to miss your main point, all right? That is it for the orientation. We're now going to quickly go through some orientation here. The video that I have right here, this link right here. After class, I need you to please click on it and take a look at it. Let's get started with that right now. So at this time, I'm going to go over this in Canvas. When you get into Canvas, your Zoom link will always be on this left side. If you collapse, it goes away. If you don't collapse, it comes right back. So if you can't find your Zoom, it's because you collapse it. But always refresh every week as well, just to make sure you can get in. I'm sorry for the frustrations that it creates sometimes when you cannot get in, but don't forget also, we have to keep the integrity of the course. So thank you so much for understanding that part. There are two gray lines. The very first gray line right here, it says class notes domain 1 through 5. And then the second gray line talks about question and answer only, PMHNP review 2024. Okay. Now, the next thing that I want to quickly show you right here is look at the tabs under the note. Under the note, we have domain 1, we have domain 2, we have domain 3, domain 4, and domain 5. And it's all sticking out. Now you want to go ahead and grab your note for tonight that says domain 2, and we're going to go through that, okay? But there is one thing I want to go through before I get here though. And don't worry, I will be sharing that with you later as well. But for right now, this is the most important one, and that's the second thing that we're going to go over. With that being said, what else do I want to talk about? Okay, so I want to talk about pillow package. Pillow package is on top right here. It says pillow package 2.0 and pillow package 2.1. I want you to please make sure you print those two documents. A lot of things that you're going to need to write down for tests is right here on that pillow package 2.0. Now, one more thing I want to quickly say is this. I want to quickly tell you that you can also get on the phone with from the computer, but you have to log on first. Log on to the computer first, and then you will now click on account, and then you will now click on QR for mobile login, and then you will now click on proceed, and then you will now see a barcode. You're going to now scan with your phone the barcode, and then boom, you're on the phone. So that is how to get on the phone. I just wanted to demonstrate that, and you can see it wouldn't let me go further. Okay, so I'm gonna now go back again to my content. Sorry, I got a little what else do I need to see? So there's nothing much here really. Those are the main things. Now for questions, you click on quizzes. Your quizzes are right there that you can take on your own. Like today, now after we finish assessment, go here and take your assessment. I promise I'm not going to check your grade. Even if I check your grade, and so what? This is a no judgment zone. You can be guaranteed. I was in your shoes before as well, so we don't judge anybody around here. Quizzes. And another thing that I want to quickly show you under modules, when you scroll all the way down to the bottom of the modules, you're going to see my sample resume. Please grab it. And that was actually my 2022 resume that I created just as a sample for my students in year 20. Can you believe it? It's almost 3 years. I can't believe it. Anyway, just clean out my details and put your details in there. 3 years is a long time, a little bit, so it's probably old by now, but you can still make use of my resume if you want. There are more questions here that we couldn't list under modules, and the questions under modules, some of them are also mixed in here. You have a total of 450 questions in Canvas, but Canvas question is not the best thing to focus on when you first come. You want to first of all focus on your content. So what content do we have in here? Let's quickly go over that in a little right now. We have neurotransmitter basics. Exactly, it matches my note exactly in class. We have neurobiology. So because they both start from neuro does not mean it's the same exact thing. Don't worry, you're going to go through that class in a week and a half from now. Or if we have a bonus, I can actually offer it this weekend if we have time, right? Extra time. It can happen before my cycle begins, all right? Now, what about neurotransmitters worksheets is right here. You do it as an assignment, and then I share the answer in class. We have psychopharmacology for clinicians is right here. Substance abuse content is right here. And then domain 2 talks about what psych assessment. You're going to click this and pull this up tonight. And then we have psych assessment worksheets right here. Extremely important that you work on it. And then the answer is right here for that one. It's going to help you lay your hands on things that you never got the opportunity to lay your hands on when you were in clinical. And you're like, Kehinde, am I really in a board exam review? Yes, you are. Exam is that serious. I am not exaggerating, trust me. I'd rather you be over prepared than to be under prepared in that exam room. Okay. Now, domain 2, scales and intervention. If you're like struggling with scales, or you will like this scale, of course. It talks in detail about MMSE, MOCA, and whatnot. And then what about domain 3? It talks about what? Diagnosis, crystal clear edition. This is from my book. So please do not share my content. I will continue to appeal to you. This is my artwork. Okay. I put a lot of time into it. Thank you so much for being ethical about this. And then we have domain 3 right here again. Just a little bit of content and questions, substance abuse, just a little extra, right? More than the actual content. Then domain 4 talks about psychotherapy in a nutshell. In fact, I should be dragging this right below the psychotherapy, but for some reason it ended up under domain 3, but just ignore it. The nutshell is where you need to start. That means that's the beginning of psychotherapy. It's just a little bit of a bullet point of what we have under family, group, and individual therapy. Domain 4 talks about what therapies and theories. Again, this is my book. I broke down my book for you in slides or in Word document so that you can have something to actually read. Now, domain 4B, motivational interviewing and logotherapy. Domain 5 talks about detailed roles and leadership notes, worksheets for practice, and then for the roles and leadership. I created worksheets. I focus mainly on research because many students were having problem with that. And I can't remember if I put answers here, but if I didn't, don't worry, we're going to go over it in class. But that's something for you to also work with. But when family therapy, a student took a test last week, and this recovery model with the video that I linked in there helped her a lot. So don't forget about this because it talks about resilience. Don't forget about that content. Exceptions to confidentiality in mental health. Of course, you have to know when you don't need consent and when you need consent. And then extra support start. This is just extra support. So this is extra, guys. This is about all the competencies. And then I give questions for each of them. It's too detailed to be very, very honest. It's for those students that are not connected at all with roles, leadership, and ethical principles. And then the next gray line is your questions and answers. And that is Canvas for you right there. Another thing with Canvas is files. Under files, you come in here, make sure that this arrow, if it's pointing straight across, make sure it's pointing down. And then you can click on your drug titration, and then you can connect with drug titration content. And then you will see some of this stuff in there. All right. So that is that. But I'm just telling you right now, we can't teach everything in class. So I'm slowly releasing some of my videos. I will look for a platform where I can lock it down. My pillow package right now, I released it as well. I released the unlisted YouTube link, so it's not for the public. I am pleading with you, stop sharing that Zoom link, that YouTube link with the group. And I know it's going around because it's almost 700 views in less than a week. And it's not public. If it's not public, it shouldn't have that many views on it. So let's keep things private so I can continue to be confident to share more. All right. At this time, we're going to get started with the class, and we're going to be starting with psych assessment. Now, I told you we did neurobiology and psychopharm last week. We're now going to be doing psychiatric assessment this week. Does it make sense? Now, don't worry about what we did last week, because guess what? You will see that we're going to get there in another week and a half from now. Do we have any questions? So the next thing we're going to do is we're just going to quickly give you an overview of the new study plan from August 2025 to 2026. So you can see the structure and how things are laid out. Don't forget, when you believe in yourself, anything is possible. Wishing you the very best of luck in your exam. You have worked hard to get to this point. You will make it through. Continue to believe in yourself. I want you to pay attention to the check marks here. You're going to go through this course two rounds. First round, you're going to check off. Whenever we go through neurobiology, neurotransmitters, you will check it off. Whenever we go through psychopharmacology, you check things off. Whenever we go to psych assessment, you check things off. All right. Does it make sense? That is how things work. And then the second round, which is the third week, you're going to start checking things off again. You must have like two checks behind each. So let's now go through the details of the study plan. Thank you. Good day, and thank you so much for logging into class today. Today is August 19, 2025. We did update the syllabus or the study plan for the class time. And it says we're excited to announce that our courses are fully designed based on ANCC course outline. And of course, AAMP is the second exam, and that is another class entirely. Some things overlap, but not everything. Our course is robust, providing essential content you need. We recommend you focus on content during the first 2 weeks of your study. We support students with ADD, ADHD, high levels of anxiety, and learning challenges. To ensure you succeed, you will have access to your instructor at least 4 times in a week. That is Tuesday, Thursday, or Saturday and Sunday. So you also have me on Monday and Friday. If you need help, you can call or email, and we will reach out to you, but expect it to be around 24 to 72 hours. We utilize a variety of learning styles, including audio, visual materials to ensure comprehensive content absorption. Additionally, we incorporate simulations to enhance your learning experience. We're not trying to take you back to school, but we're trying to solidify your base too, because a lot of students did not have good clinical skills, and you still need that skill to succeed on your exam. So here's how we help you prepare. Content is key. Make sure you check off the domains as we cover them. 2 checks are required beside each domain before you actually take the test. You don't need to attend all 3 classes or 2 classes per day. Now we have 2 classes per day. We have classes on in the morning and at night. Allow time for private reinforcement of the material as well. But if you want to come to class for all sessions, you're welcome to do so. Now, regular reviews. Every week we will have a taste of all domains. That is something to kind of capture everything we've done the entire week, or to kind of bring it to your reminder. For example, if we're on domain 4, we're going to go through neuro a little bit. We're going to go through, psychopharmacology a little bit. We're going to go through psychiatric assessment, a little bit of it. We're going to also add test taking strategies all into this taste of all domains. Does it make sense? And then we're gonna be doing last minute review every day you come to class. Pretty much it is fully integrated into our courses. You're gonna see it on the study plan right now. I'm gonna show that to you. Holiday and schedule adjustment in 2025 and 2026. Be mindful of these days that we're going to be having off. If you're still in class, don't forget this review is for 6 weeks. After 6 weeks, you upgrade to remain in class. Please make sure you check your date so that you will not get cut off from Canvas. Now, in addition to that, I also have 2026 dates in here. You don't need to worry about that, of course, but be mindful of this. This will be course maintenance. You're going to be taking exit exam. This will be a mental break for the student so that you don't have to keep learning continuously for 6 weeks. So this course is 6 weeks long. After that, upgrade is required. Again, I'm emphasizing now, we do have Charles Drew students. They should be coming to join us soon. Normally, they are here for 4 to 6 weeks. So that will be announced when they are back in. Now, we are confident that this structure is sticking, and sticking to your schedule, and, utilizing your support will help you and set you up for success. And that is my signature right there. So please pay attention to those dates. Make sure you screenshot it, copy it, have them together so that you will not log on to class when you're not supposed to be here. But this is the study plan. Now you'll see that this color is different. Before it was purple. Whenever I make a change or an update to a study plan, the color always changes. So now August 26th is when this begins, though. I'm aware that today is August 19th, but I have to put August 26th here because I want it to begin with neurobiology next week. But today we're doing roles, leadership, and ethical principles, and then we're going to be doing therapies and theories on Thursday. But anyways, so now August 28th, psychopharmacology. September 2nd, and then at the beginning of everything, you're going to see multiple choice questions and questions, last minute review. That is the integration. I decided to specify last minute review this time so that students will know that it's actually essential for them to come to class, for them to get that last minute review. And that goes on and on. And at the end of every set, like every 5 domains, we go ahead and take some days off. 2 days off for sure. September 16 or September 20, there will be no class. What are you going to be doing? You're going to be doing your readiness assessment exam. You're going to be completing your questions. I'm going to add more questions to Canvas. You're going to be studying your pillow package. You're going to master the key concept. I just want you to breathe, breathe after every 5 domains. Let me know what you think about this new structure. That is the only thing that is new. I will be adding a little bit of a break for you mentally and physically so that you can settle into the course. And then by the time you resume back again, we'll begin again from domain 1 through domain 5. and then you're seeing it for the second round, and then you're ready to exit the course, or you can choose to do what to extend if you want to extend. But so, and I put a date right there as well. I hope it all matches well. But anyway, that is pretty much what the new study plan is, and that is how robust our coursework is. Looking like a school, I get it, but trust me, it takes this much effort to actually pass the test. Don't forget, no strategy without content. Absolutely none. Dr. Kehinde Elisha speaking here, founder of MP Certification Academy. You may want to come join the circle of exam success. We have 99.9% pass rate. You don't want to miss out on that. After you pass your test, guess what? We also have a group for our students that passed already. www.confidentprescriber.com. Now, you don't have to pay to join the expert group, but we do have courses that we sell. All right. Have a wonderful day, and I look forward to seeing you in our review. Oh, just before we exit, before we exit the orientation, take a look at this website. This is our website right here, www.npcertificationacademy.com. That is www.npcertificationacademy.com. So the navigation goes this way with a lot of explanation, and we're going to slow it down or remove some words. Maybe I should cut some of this off to keep things really simple, like these long words. Nobody's really reading it looks like. But anyways, don't forget that you do have 15 CEUs come with this course, but a lot of times it's based on request. The same thing here. Now we have AAMP and we have ANCC exam, and I have them separated. So a lot of these words, of course, I will be quoting short so that it's now on the main page and you can just learn more link on the same page. But anyway, so what is our approach? Simplification, repetition, retention, success. So what kind of review do we offer though? It's a blended review. What does that mean? Also, I need to make it clear that we do have recorded messages as well. And those recorded messages are blended, meaning you are still in contact with me every time you come to class, which is golden. A lot of times, some people just sell recorded messages, and there is no way to have a contact with the student, nobody for them to ask questions, and that is a problem. So I want you to know that the content is so large that we cannot handle everything with our voice. You're going to have a lot of appreciation for this course, but let's give it 2 to 3 weeks before we make any judgments. Let's not forget, words are powerful and they circulate pretty fast. So whatever you say about our course, let it be the true judgment, and that's not what you see on the first day or the second day. So please do your best to soak in the information. Do your best to observe and see what we're doing. Do your very, very best to trust the process. I promise you will not regret it. All right. My contact is on the home page right here. You can always reach out to me. The very best email is nostoknowscoach@gmail.com. And if you're not already in our after you pass your board exam, we also have the experts group right here that you can also connect with us. You don't have to pay to join the experts group, but we sell courses for the experts group. So before you start working, we can connect you with the right information. Now, with that being said, when you click on the home page, let's go back to the home page right there. We also have flashcard and Q banks. It is down for now. I will bring it back up very soon, but not right now. And then we also offer NCLEX exam review, and the packages are right here. We also offer FMP, AGMP, AGA, CMP, and the packages are right here. All right. In addition to that, after you pass your boards, don't forget, we network. That is a big deal. You can ask me questions, email me, call me, text me. Text is very, very fast, especially when I'm teaching. Make sure that if you should get locked out of your Canvas, ensure that you find a way to locate your email, or email me and I will tell you what to do. Locate the very first invite and accept the invite again. So that very first email that you get, not from me, from Canvas, is important to keep it in a safe place. That way you can use it to log back into class. On our main page, there are other things you can see. That is me right there with over 20 years of nursing experience. And of course, we have been teaching for more than 5 years now. And that is also me right there. That's a review with code. And then for the sample teaching is also here. And some other things are right here, just in case you didn't get a chance to visit this web page. I had the opportunity to visit the World University students. And of course, that's me right there, straight from the airport to the graduation. We look forward to more graduations to come. All right. Thank you so much for trusting us. We're not going to disappoint you. We're now going to get started with the next domain. Do we have any questions? We don't. Speaking is Dr. Kehinde Elisha, founder and CEO of NP Certification Academy. To reach us, nurse-to-nurse-coach@gmail.com or visit www.npcertificationacademy.com. And our address is also there, business address. All right. Thank you. Bye-bye. This time, that's the end of my orientation. Thank you. Any questions?